Thank you for your kind introduction. It's my great pleasure to be here and to share my experience on tumor ablation with you. Fortunately, we have many weapons for liver ablation, so the careful selection is really important, as previous speaker talked about it. This is my disclosure. What are the primary indications for liver ablation in our center? As you know well, HCC or metastasis, smaller than 3 centimeters, less than 4 in number. Which imaging modality do we use? We prefer ultrasound rather than CT or MR. What about the energy source in our center? And still, we more prefer radiofrequency ablation rather than microwave because of a couple of reasons. Do you do planning ultrasound? Yes, almost always before 1 or 2 weeks before the ablation. It is essential. What about what do you assess in planning phase? We assess the tumor as well as patient. It is very important. The careful planning is really one of the half of successful ablation. What kind of anesthesia? We prefer MAC anesthesia using the remifentanil and dexmedetomidine by anesthesiologist. Treatment assessment, we do CT immediately after ablation. After that, 1 month later. After that, 3 months, at every 3 months for 2 years. This is my recipe for liver ablation. As we all know, the tumor size and tumor conspicuity and tumor location is a critical factor for successful ablation. But recently I found another factor, tumor exit, which means if there is enough normal parenchyma, posterior margin of the tumor is very important. So if the 4 categories are satisfied, I just do single microwave ablation through the central core of the tumor. If any factor is not meet this criteria, at that time I prefer multiple radiofrequency ablation. I prepare 2 cases. The first case is a conspicuous HCC with the exit as safe location. This is the best candidate for single ablation using microwave. I use the imprint microantenna towards the center of the tumor is very important. After that, carefully insert through the center of the tumor up to the exit of the tumor. It is very important. I do so-called centrifugal ablation with 100 watt and using the ultrasound marker to monitor the adequate ablation. After 4 minutes later, there is no bleeding along the lateral path, actually no wound, so definitely minimally invasive than surgical section. The pre-MR and post-ablation CT is quite successful. So moving on the second case, 2 centimeter inconspicuous tumor in segment 6. This tumor is very inconspicuous on ultrasound. That's why I choose multiple RFA. 2 centimeter inconspicuous tumor in segment 6. When you use the Samsung ultrasound, we use the S-fusion technique. It's very simple. Just put the probe in the parasagittal plane on the sigmoid process and automatically match the plane registration. After that, we can add 1 or 2 point registration. We can get very nice fusion matching like that. The point registration using the anatomic landmark such as portal vein branch. As you can see, the tumor margin is not so much clear. That means it is dangerous to use a single central ablation. And then to avoid any thermal injury aborting the ablation zone, I made artificial ascites using the 5-French angiography shears like that. This is much better than just spinal needle. You can rapidly infuse the DW solution. And you can see the colon is separated from the liver, so we can ablate safely without worrying about the thermal injury. So as I mentioned before, the lesion is inconspicuous. I choose the multiple electrode, RF electrode, rather than single microwave, so-called no-touch RFA technique. Again, anesthesia to the peritoneum. This is the multiple separable RF electrode. Each electrode we can adjust the length of tip. Very flexible device compared to single strong microwave ablation. So I insert the first electrode in medial margin of the tumor, and the second electrode lateral inferior margin, and third electrode is with the superior and lateral margin. Okay, so-called no-touch technique. And the fine-tuning of the registration using the nearest anatomy landmark, for example, a branch of portal vein. So I think we just prefer the quick ablation, strong ablation, but we need to take our time to make optimal and accurate ablation rather than just a simple and quick ablation. And final plan for ablation zone using the ultrasound markers like that. We can indicate the tumor margin, as well as we can add ablative margin 5 to 10 millimeter, and we can use the 2 subluminal ultrasound. It is much better than very complicated CT-guided ablation, in my opinion. And before starting, check carefully whether the electrode position is really accurate according to your plan. And again, please take your time. 5 minutes, just 5 minute test is not so much important for our patient life. And ask to yourself 3 times. This is my recommendation. We are all in hurry up to finish the procedure quickly. Please ask yourself, are you really sure? 3 times ask yourself. If the answer is clearly yes 3 times, at that time, please start the button. This is really basic, but sometimes we forget it. Sometimes we use the contrast lens ultrasound with sonozoid. And for final confirmation of the inconspicuous tumor for final registration, and also sonozoid can decrease the popping phenomenon. And then, before starting ablation, final registration using the Cooper phase, as you can see. It looks a very long step, but just 10 minutes for accurate and optimal ablation. After that, start from 30 watt to 70 watt and perform the centripetal ablation. Okay, no bleeding after track cauterization. After that, you can check the result with CT, the complete ablation with sufficient ablative margin. So I would say goodbye, just overlapping ablation. We have to decide before starting the generator. So this is how I do it. Maybe very similar to your procedure, but multidisciplinary approach is the best key. And also please remember, the exit of tumor could be a good tips for our successful ablation. Like that, the feasibility of tumor ablation is quite variable, like a spectrum, so many spectrum for the feasibility. So depending on the exit you can choose the proper device, either microwave or multiple radio frequency ablation. Thank you for your attention.
Good afternoon,